Dental crowns are used when a restoration is too large because the restoration in the tooth weakens the wall of the tooth. And as the patient masticates, the wall of the tooth will break or fracture. And then there will remain no natural tooth structure. A crown is utilized as a covering the whole tooth to evenly distribute the mastication forces throughout the tooth. There are indications for crowns. When 2/3 or half to 2/3 of the tooth is missing, a person should have a crown. Also, anytime a root canal is done, the patient must have a crown because a root canal treated tooth is a brittle tooth, and that tooth is subject to fracture without a crown.